And good afternoon. 2nd, 2024. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine. Anybody like milk with your Oreo cookies? We have a special on Oreo cookies today. These are Oreo cookies in the spine. Our patient has had 3 artificial discs placed in his lower back, L5-S1, L4-5, L3-4. And unfortunately, he still developed adjacent segment disease at L2-3, which is what we're fixing today. In addition to that, he's got facet joint pain, and you can see his facet joints have, and look at the bone of the facet. It's darker. Here, show them that facet there, a little bit higher. Yes, that. Look how dark that is. Now go up to another facet much further up, higher up. There. Look at that facet and compare the two of them. Much darker. Those facets at 5-1 are sclerotic, meaning that there's some instability, there's some enlargement of the bone, thickening of the bone because of Wolff's law, which says that stress will cause bones to thicken. All right, we're going to get started. Are you comfortable? Good. I need to fix the L2-3 on both sides, so let's get started. Shot. Let's just see where we are. Oh, very good. Let's drop the table. We're going to move up above the top Oreo cookie or artificial disc. That's perfect. Great job. Now I'm going to try to access the L2-3. First, I'm going to give some more numbing medicine because we're passing through the skin, fascia, muscle to get to the spine. And we're going through a natural opening that's already there. It's called the neural foramen. The neural foramen happens to be where the nerve root exits. Let's see. Shot. All right, so we're aiming for the disc at L2-3. I feel the facet. I'm on his facet joint. Now I'm going to go around that facet. Shot. Perfect. Shot. I love it. AP. Now the thing about the L2-3 is that it is a disc that you have to start a little more medial to get to. Shot. All right, perfect. So the one on the left, the needle on the left is in the right spot. The needle on the right, we're still a little ways away. Go ahead and put a little numbing medicine. Perfect. All right, so I'm going to continue with the left needle, and I feel the herniation right there. I just touched it. And so we're going to enter this disc so we can fix this herniation. Now, I'm going to be testing this just to make sure it is the cause of his pain in just a moment. Shot. All right, first I would like to try to place the other needle at L2-3. Shot. So before I get started on the disc repair, I want to place both needles. Shot. 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 AP. All right, so at this point we're at L2-3. We've got our left needle placed. We still have to place the right needle. I'm in the process of doing that. We use X-ray for 2 things. 1, localization. 2, navigation. So I'm using it right now to navigate to the L2-3. Is that it right there, Shot? Now we use a top-of-the-line fluoroscope. This is Siemens, which is a German company, and it is a flow, and they make the very best fluoroscopes in the world, which is why we use them. All right, we're ready for this patient to help us. So far, remember, he's got an artificial disc at L3-4, another one at L4-5. My artistry is horrible, and another one at L5-S1. Okay, these are artificial discs. Now, above them is a disc that's damaged with annular tears. And he had a choice. He could either have another artificial disc, have a fusion, live with it, and he chose the Deuk laser disc repair. Are you comfy?
You doing all right? He said yes.
All right, you're here. I'm Dr. Deuk-Majan. We're going to get this disc fixed. I need your help, okay? Are you having any pain?
Are you having any pain right now in your back? You said yes or no? Sorry, we can't hear you say it again? Yes, no, sir.
All
No,
right.
sir.
All right. We're going to put you to sleep in just a minute, but I want you to...
Keep your head still.
Yeah, lay still, okay?
Perfect.
You're doing great. Everything's going perfect for you. This is the part where we wake you up for a minute, though, okay? How bad is that on a scale of 1 to 10? How bad does that get? How high does it go?
What number?
9? Is that where you get your pain? All right, sir, you just had a discogram. Now you know what a discogram is all about. And it confirmed your pain source. I want you to count from 1 to 100 out loud. When you wake up, your surgery will be over. Pleasant dreams. Perfect. So now we know that this disc that we knew was causing problems, mostly his legs, but now we know it's also causing back pain. And he had a 9 out of 10 response, and it's concordant, meaning that's where he gets his back pain. Jordan, show us on that x-ray. Henry, take a look at the x-ray. You could see a tear in the back of the disc. See the tear right there? Circle it, yeah.
Yes,
the black tear. And that's the dye escaping through the tear. And now look at it covering the herniation. It kind of leaks out and, you know, gets on top of the herniation so you could see it. And he's got a herniation on both sides. We're going to go in there and clean that up. All right. Dr. B, can I proceed? Shot? No problem. Now this is a patient who, you know, was aware of his options and chose what he felt was the best treatment for him. And he continues to do that. I am a big proponent for laser endoscopic surgery. I'm totally against artificial discs because I know exactly what artificial discs are done to treat. They're used to treat herniated disc, bulging disc, degenerated disc, ruptured disc, extruded disc, protruded disc. Well, those are the same things the Deuk laser disc repair fixes. Let me know when I can proceed. Let's show our audience, Henry, why do these annular tears cause so much back pain for people? Can I proceed?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
Okay, welcome back. And you can see from our video that what causes the pain that people experience in their back 85% of the time is a disc injury. And the way the disc causes pain is through the tear in the back of the disc that gets so much inflammation in it because there's a piece of herniation stuck in it, shot. And that herniation wants to get out because it's under pressure. You know, every time you bend, lift, twist, do normal stuff, that's nice. Fits in perfect.
Yeah.
Okay. And so what happens then is that, let me just double check this. That's in the center, right? Yeah.
It is, yes.
All right, good. Just the other side looks odd. Great. What happens is the piece of herniation gets stuck in the tear, and that your body tries attacking it to get rid of it. And in the process of doing that, that process is called inflammation. You end up creating scar tissue, bone spurs, and creating new pain nerves that weren't there before. It's all part of it. We call that neoneurulation, new nerves. Neo is new, neurulation is nerves. So you get all this shot, neoneurulation happening, and those new nerves, they're pain nerves. They have very delicate nerve endings that are very sensitive to pressure and inflammation. Shot. And so what happens then, I think we're in, is any kind of movement of the back triggers pressure onto those new nerves. And those new nerves are in the inflammatory tissue in the back wall of the disc. That's what we're fixing. This is the only surgery in the world that does this. And it was created right here at Deuk Spine Institute, pioneered here. Other surgeries take the disc out, fuse it, take the disc out, artificial disc. They do all kinds of other stuff, but none of them address the source of back pain. The Deuk laser disc repair is the only one. We are inside his disc. You can see the tear right there. Now, Henry, let's show the audience what we're going to do with the laser.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see now with that video that what we're doing with our laser and endoscope is we're identifying where the tear is, and we're using the laser to remove pieces of herniation out of the tear, and cleaning the inflammation, cleaning the herniation, cleaning the bone spurs if there are any that we need to take out, cleaning up the painful tissue. We call it granulation tissue. There's a piece of herniation right there, that white thing. It's not the biggest one I've ever taken out, but it's about 5 pieces now, about that size we've already gotten. Here's some more right here. All right, Henry, I think if we could show our audience our video on 30 causes of back pain, chronic back pain, that would be nice. Chronic back pain, folks, is defined as pain that's been there. Ooh, there's a good herniation. Take a look at this one. Let's get the camera on here. Can you see it?
Yes, we can.
Bring that tape measure. Look at that thing. That's a nice piece right there. There's the tape measure. Can you see it?
Yes, we can.
It's about 1.5 centimeters long and about 1 centimeter wide. But that's, again, just one piece. We've had about 8 of them now come out of this one disc on the same side, left side. And there's more pieces, right? So, you know, herniated disc, a lot of people think it's one piece. It's not. A herniated disc is multiple events that happen over time, and they all begin with trauma. Trauma to the disc. And what causes that trauma? It could be a sports injury. It could be a fall. It could be a car accident. And it's always traumatic that causes a tear in the disc. And at the same time as the disc annulus tears, the nucleus next to the tear gets crushed and it fragments into little pieces, okay? And then those little pieces start to work their way out through the tear. We figured this out at Deuk Spine Institute. We've been talking about it for years. The evidence is here. All these fragments of disc herniation that are sitting here in the tear or adjacent to it in the disc. and they're all just waiting to come out, like a line of people waiting at an amusement park to get on a ride or at a restaurant waiting to get in. Okay? And the more pieces that come through the tear, the more full the herniation becomes. Some pieces are small, some pieces are big, and every time you push another piece out through the tear, it makes the herniation bigger and resets the inflammation, restarts it. So you can see the tear right here. And we're starting in the deep part of the tear. We're going to work our way out to the superficial or surface of the disc. There's another piece. Everything okay, guys? Good. How's he doing, doctor? Good. All right, that's what I like to hear. Now, one thing that is important to keep in mind if you do endoscopic transforaminal spine surgery is you always want to not just look what we call medially towards the midline, you want to look also laterally in the foramen, because some herniated discs are lateral and you've got to get those too, otherwise they could cause pain or pinch nerve for the patient. I learned that lesson the hard way about 18 years ago when I didn't realize that I needed to do that, and I left a piece of herniation in. Patient came back with pain and symptoms, and I took an MRI and saw that there was still a big piece of herniation that I never got that was causing the problem, and it's because I didn't go lateral. Guys, what's going on with my irrigation? Get it fixed, please. Thanks. Huh? It's working better, yeah. Oh. Everything okay, guys? Dr. Davis? All right, we are at the outside of the tear. We are just about finished. This is the most painful part of the surgery, this outer part of the tear. Guys, is the next patient here ready to go? You can actually see the gold color is calcium, shouldn't be there. Comes with chronic inflammation called dystrophic calcification. The blue fiber is the laser fiber. It's the plastic cover around it. This is the lateral part of the herniation. Having the irrigation issue again. This is just the furthest back part of the herniation, and I'm working my way more centrally towards the midline. Need to get this area. This is important to get. We're not just going to leave this here. But things are looking really good, and he's doing quite well from an anesthesia standpoint. From a surgery standpoint, he's doing awesome. Look at all that scar tissue there. The white, thick stuff, right? That's really hard. The laser, doesn't struggle with scar tissue, but the way that the laser energy interacts with scar tissue is different than how the laser energy interacts with a soft herniation. Okay? That's the tear. Hold the tube. Guys.
The irrigation is good?
Now, we never get 100% of the herniation. No doctor in the world can do that. It's impossible. And that's because the window or corridor, surgical corridor we have, doesn't allow it. It's impossible. It doesn't matter how you approach the disc, whether from the front, the side, the back, you cannot get 100%. That would be like walking into a house, into the front door, and expecting to see 100% of the house through that front door. You just can't. There's rooms, there's walls, there's doors, there's corridors, and you have to move around to be able to see more of the house. But some houses, like a flat, you could see everything, but we don't have such a situation here in the spine surgery world. There's no way to see 100% of the disc through any approach. All right, just about done. Let's just take a look here. There's the outside of the disc. Hold it there. And again, this is real thick scar tissue right here. Clearly not a normal disc. Clearly an injured disc. And painful because we tested it. All right, Henry, do we do the 30 causes?
We have not yet.
Let's do that and then we'll take questions.
Copy that.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. Welcome back. You can see from our animation that we created here at Deuk Spine that there are 30 different causes of back pain, chronic back pain, and the most common is the disc. A disc injury is by far the most common. It is the #1 cause of chronic back pain. It always takes trauma to injure a disc. It takes trauma to injure the other joints as well. Whether it's the facet joint, the SI joint, the piriformis, all of them require trauma to injure them. However, the trauma doesn't always have to be an accident like a car accident or a slip and fall, but it could be a sports accident or bending over wrong and tearing your piriformis muscle when you got a deconditioned muscle. Disc injuries, on the other hand, facet injuries take serious trauma. There has to be a force on the spine, whether it's a sudden acceleration, deceleration, twisting. There's a tear right there in this disc. You can see it. You got some blue stuff, which is the herniation from the center squeezing out in the tear. The reason the herniation is blue is we use the blue dye. And this dye, the Deuk Spine dye, only binds blue, only binds to the nucleus pulposus, but it only binds to degenerated nucleus pulposus. So it will not bind normal nucleus pulposus. So normal nucleus pulposus is white. Normal annulus fibrosus is white. Bone is normally white, at least the end plates are, and the ligaments and tendons are all white. The only thing not white is fat, which is yellow, and blood vessels, which are red, and the ligamentum flavum, which is yellow. But aside from that, everything else should be white. And you see a blue herniation because it's degenerated, meaning it's been affected by the body's inflammatory system. It's been attacked, and it's now, as a result of the attacking by inflammation, it is what's called acidophilic, or acidic is an easier way. And that means that its pH or pKa of the proteins has been lowered down into the acidic side of the spectrum. Long story short, what does that mean? It means that it binds the dye, so it helps me see it. There's this tear right there, and the laser is cleaning it up. This is all annular tear. Now, to get this annulus to heal and seal, you need to clean it out, and that's what the laser does. You got to get rid of the herniation, you got to get rid of the scar tissue, you got to get rid of this gold color stuff, which is calcium. To do this type of surgery requires specialized training above and beyond what other neurosurgeons and orthopedic surgeons go through. The training program for this type of surgery is most likely an additional year of training. It's called a fellowship. I went through this training years ago. It was in addition to my residency and fellowship training, which I already had. I had to do additional training in endoscopic surgery, laser surgery, and now with 2,000 cases under my belt, this is something that we're very comfortable doing here at Deuk Spine. Any questions from the audience?
Yes, we have a question from Mixin' On Up on YouTube.
Hi, Mixin' On Up.
They ask probably why Toradol is the only thing that touches the pain. All
Yeah.
that inflammation, but very unfortunate it's such a hard drug on the body.
Yeah, you're right, Mixin' On Up. Toradol is an anti-inflammatory, and because this pain from the disc is inflammatory, then maybe that's why Toradol is so helpful, right? But you're right, Toradol will chew up your stomach, your kidneys, but whether it's disc pain that's inflammatory or facet joint pain or SI joint pain or piriformis, or even a fracture. When a vertebral body fracture hurts, it hurts because of inflammation. So all pain in the spine is due to inflammation, all of it. That's why anti-inflammatories can be so effective. However, the over-the-counter stuff like Motrin may not be as effective because you take it orally, and you know the way that it's called bioavailability is not great. You have to dissolve it in your stomach, you gotta absorb it, and then it's gotta move through the bloodstream to the different areas of inflammation. Dr. B, 3 minutes. And then it's got to have an effect on those cells, right? Once it gets there. And the way NSAIDs work is they affect, I want to say, prostaglandin synthesis, right? Fernandez, do you remember? It's been a while.
Yeah, they block the cyclooxygenase pathway.
Yeah, cyclooxygen.
To stop the formation of
Prostaglandins.
block the prostaglandins for inflammation.
Ah,
PGF, PGI2,
yep.
interleukins.
Yeah,
All those
so
are the inflammatory, the primordial soup.
primordial soup. Prostaglandin, cyclooxygenase, biochemistry.
So you got the cyclooxygenase, then it goes to the leukotrienes.
Uh-huh.
Got the leukotrienes broken down.
That's right,
They work with the
leukotrienes.
prostaglandins and the prostacyclins.
You're speaking my language now. Yeah, inflammatory pathway. You can look it up on Google, learn a lot about it. All right, we're just about done.
You were shocked that I do that.
Uh-huh. I'm going to go in there and try to pull out some more of this stuff. But at this point, when we're done, this disc will just need to heal. And it's going to take time to heal. Time that I can't give the patients. You guys have to give your disc time to heal. I can't speed it up. It's impossible. That healing is 1 year. I tell everybody a year. Maybe you'll heal at 9 months, but I don't like to say 9 months because then somebody may go out and do something at 9 months they shouldn't do and re-herniate their disc. The re-herniation rate for this surgery is 1%. That means 1 out of every 100 patients will re-herniate. We've had about 21 patients re-herniate now out of 2,100 patients. That's a 1% reherniation rate. Any more questions, Henry?
At this moment, no current questions.
Dr. Duke, would you like to see the next patient is doing very well, or can you get
They can send the last patient out if they want. It's fine. I mean, I'll be done in a minute here, so. He's doing good. He wants to leave.
Yeah. He was wide awake.
Oh, really? Good for him. All right. I think we're done. Let me just grab a little more and we'll be done.
Yeah,
Once again, huh?
Cracker and ginger ale recovery, right?
Yeah.
You did great.
Well,
Going on, yeah.
yep. I'm happy here. This looks really good. We just finished fixing the L2-3 on both sides, left and right. And I can't get any more herniation out of here. I'm very happy with the result. There's the fat in the epidural space. The nerve root will be up there in the fat. Let me do just another blast right there real quick. I want to clean that up just a little bit and then we're done. So 30 seconds and we'll be done. If you have questions, type them up. Happy to answer them for you. The nice thing about this surgery is I can see the disc herniation and I can pretty much age it, tell you how old it is. Now, reality is that most of these herniations are different ages, right? So there's an initial injury at maybe 5 years old. Then there's another injury that happens at maybe a couple of months old. So I can actually see all the different ages of all the different injuries because I'm looking right at the disc. And I understand the pathophysiology of repair with the inflammatory system. All right, we're done. I'm happy with this. He should have some really good relief of his pain, but he's still going to have the facet pain until we fix that. And the facet pain is happening where his artificial discs were put in. Common problem with artificial disc is facet pain. Look it up. Happens all the time. It's one of the probably number one reason for failure of artificial discs.
But
Is
surgeons will tell you that you don't get the adjacent segment. They'll say you don't get that.
Yeah.
Right?
Well, it's facet. It's behind the artificial disc. This is adjacent segment. But, you know, facet arthropathy is supposed to be a contraindication to artificial disc placement, but a lot of these surgeons will still do it anyway, even though there's facet arthropathy. And his arthropathy isn't that bad. So I don't really blame them for wanting to put an artificial disc. But somebody should have recognized the facet pain and treated it by now. Somebody besides me. Okay. We're all done. Henry, any more questions?
No current questions.
Let's end our stream and we'll be back shortly with another surgery.
Copy that.